Hi, I'm Dr. DeFabio, and it's a great day to continue our discussion on foot and ankle injuries. Specifically, we're going to talk about taping of the inversion sprain of the ankle. Years ago, the treatment of choice when someone came in with an inversion sprain, they rolled their ankle, was one of these guys, okay? A immobilizer brace, and at the time was very thoughtful and really state-of-the-art. It would wrap around the ankle. Lift your foot up for a second, Mike, and down. Strap it on, and then it would prevent the ankle from rolling. They're still used quite a bit. I've had this one in the office. It's brand new. I took it out of the box to show you. Probably about 5 years. We just don't use them anymore. We don't need them. Like I say, the protocols we use here for inversion ankle sprains, we get our patients back in 2 to 4 weeks on the field. We're talking athletes. So, two major ligaments that are going to get involved are going to be your calcaneofibular, the one that runs in through here, and your anterior talofibular. Let's tape those. Flex the foot up. First, we're going to put some coverall to protect the skin underneath it, because the tape we're going to use is basically going to do the same thing that the ligaments that have been sprained do. So you anchor this on the bottom of the heel on the other side, and you come right up the side of the foot. This is just to protect the skin, because the tape that's going to do all the work is this, okay? It's Leukotape. It's a very, very rigid tape. I call it medical duct tape because it doesn't give. It's not white zonous tape, which has some elasticity. You put this little pleat in it, and that pleat gets centered right over where the ligament we want to protect is. So the pleat wasn't in the right spot, so let's make another pleat, or a tab it's also called. Perfect. So your your calcaneofibular ligament runs from the end of the fibula here to the calcaneus, the heel bone, and that's where my tab is. And that just goes down like that. Foot's all the way up. Hey, Mike, did you say hi yet?
No.
Oh, Mike, you gotta say hi. So then you take another piece of tape, anchor it on the bottom, and just wrap it up, and you grab that tape. Go right onto that tab. So we don't want the foot to roll, so I'm going to put my finger in there and grab that tape, and I'm going to give it a good pull. And that's going to tighten it up. So the double layer of the tape over the tab right here where the ligament is going to resist that foot from rolling, okay? And it's going to give us enough resistance where it'll protect it, all right? We do this in addition to the adjustments, in addition to the soft tissue work, in addition to laser, in addition to radial shockwave therapy. And people get back in a couple of weeks from ankle sprains. Now we're going to do the anterior talofibular ligament, which runs right in here. Same technique. Just going to put the coverall over it. I'm going to take a smaller piece, put a little tab, a little pleat in it, right over the anterior talofibular ligament. Take another piece. Again, the skin can just get irritated from the Leukotape. That's why we don't like to tape it. Grab that tab, put your finger in there, pull it over, get good authority. Anchor it down, okay? You can do any area of the body like that, okay? Sometimes we need to support the ankle to really keep the foot up. I might give it another stirrup. Sometimes we have to do another one back here for the calcaneofibular ligament. And that's where my job as a doc is. I need to be thoughtful about what I'm applying and how I'm applying it. And sometimes we'll put a piece of coverall just to kind of protect it. That'll stay on about 3 days. You can shower with it, you can bathe with it. But that will prevent the foot from rolling. And it's much better and much easier than one of these. Well, maybe not easier. This is easier. That's better, especially if we want to get back to function. Hey, it's been a great day to talk rehab and ankle taking for ankle sprains. Please share this video. It's a good one. We'll talk to you soon.